Well, hello, everybody. We have a bunch of questions to get to. So welcome to another Zoom call. I have everybody muted. And again, you can chat in your questions if you want. And we will answer them. Most people chat them in. Everybody's muted to begin with. All right, welcome to another Zoom call. Let's get going. Remember to look at our blog on our website. If you have questions so that you don't have to wait to the Zoom call, or look on our patient membership site for your questions so that you don't have to wait for the Zoom call. Hopefully everybody's on the membership site. If you're not on the membership site, send me an email, info@Connor's Clinic. Everybody should have gotten an invite. Yours might have gotten buried. Send me an email and I will get you on. I'll get you another invite sent to you. All right, some questions. This is on the Nagelase test, and I'm going to make a video about this, so I'm going to skip this question. The person who asked this question actually said this would be a good video question. I agree. I will make a video on Nagelase. Other question came in about using vitamin C in antibiotics, and they cited this research study using vitamin C and antibiotics, a new 1-2 punch for knocking out cancer stem cells. Just remember, I cannot, and we cannot as a clinic, recommend medication. So we have to be careful with that just from a medical legal standpoint. So certainly if this is something you want to try, there is a group called Care Oncology that uses different medications off-label, like metformin and doxycycline, as help with cancer as well. They certainly don't recommend that it's the only thing you do, but it is something else that you could do, and you can look at their information and utilize that information. Of course, we can't prescribe them. Here's a question. Will the zeolite, so this person is taking zeolite that they have, it's not from us, pull out other things. So zeolite is a chelator. So when you're using a chelator that you could absorb, so it's getting across the gut wall and getting into the bloodstream, yes, it will pull out other things. Chelators will chelate heavy metals out of your body, but chelators also will chelate things out like minerals that you don't necessarily want to chelate out. So understand that with using any chelator. So if you use a chelator and you're using a pretty high dosage of it to try to get out heavy metals and things like that, you want to possibly think about adding some nutrients back in, some minerals, especially sodium, electrolytes, and things. Are there specific labs he should check? If you do a full complete metabolic panel, it will test for a lot of your electrolytes like calcium and sodium and some other just standard minerals. That's a good thing to look at. This person is talking about their brother who has brain cancer. So it's more unique than some of the other people that are on this call. How much zeolite should he take? That really depends on the product itself. And if it's not coming from us and you're taking it on your own, I would just tell you to take it according to the label of the product, because otherwise you don't want to take too much of any chelator and overwhelm your liver too. So you can overdose. In a sense, you can overdose on a chelator. If you take too much, remember, go back to the 7 Phases of Detox book. If you have not downloaded that, it's just a short little booklet. It's a free download on the site. If you haven't done that, make sure that you look at that. You don't want to overwhelm your detox pathways. You end up with a Herxheimer reaction. Also wondering why his cognition varies so much by the hour and by the day. Is this common with glioblastoma, mercury, biotoxin toxicity? Yes, it's very common with any of those things. individually. If you got all three of them, it's even more so an issue. So yes. Also, I'm really concerned, this is a different person, really concerned that my entire left breast, the area under my hand, including the nipple, is very hard. I can push on some of the areas and the indentations stay there for a minute or so. And the breast is now about 1.2 times the size of the other. Is this something I should expect with the black salve process? Well, it's not so much something that you should expect with the black salve process. This can happen with anything. So typically, this is a person that has an open wound on their breast exposing the cancer, and they're choosing to use a topical black salve, which is a bloodroot paste that can kill cancer directly. So the benefit of having a cancer come to the surface, whether it's a squamous cell cancer, whether it's a melanoma, whether it's a breast cancer that comes to the surface, the benefit of a cancer coming to the surface and breaking open the skin is that you can use topicals on it now. That's a very scary thing for a lot of people. Oh my gosh, the cancer broke open the skin and it's coming out of the body. Yes, that can happen for multiple reasons, but it can be a benefit because now you can use topicals on it, and by using topicals, you can kill more directly. Well, black salve bloodroot paste is a type of topical that you could use on your cancer, and it does kill very effectively with really, it doesn't cause any pain to the area itself, except for any stretching of the skin. So when you use black salve on a melanoma on your arm, let's say, you will stretch the skin as this cancer is drawing out, and that will be painful. Typically, when you use it on your breast, there's a lot less pain. Not so much a need for any pain medications, and you can kill directly. The negative is that the cancer by this time is obviously probably fairly large. And if it's fairly large, then there's a lot of drawing that has to take place. So you may have to apply black salve. It may take multiple days to weeks for the first eschar to come off and the cancer to come out. And then you put black salve on again, and it takes multiple days for it to draw out more deeper cancer. And you might have to do this many, many times. We have one person, I think, is on their 14th draw and no signs of ending anytime soon. So that's common with breast cancer. It's also common with melanoma. I had a patient with melanoma that did it 13 times that he drew out cancer on his forearm. It just kept drawing deeper, kept drawing deeper, kept drawing deeper. His wound itself, the scar itself, never got any deeper, but it kept drawing cancer cells that were deeper than the depth of his wound. And for sure, he would not be with us today if he did not do that. So that was, goodness sakes, that had about 5 years ago at least. All right. I have done 3 flushes. This person's talking about gallbladder flushes. 3 liver gallbladder flushes in the month of April and May. First, I saw very little stones. And a few hours later, I released a lot of green pea size like balls floating, and which were soft to touch. Dr. Berg on his video was explaining that these green balls are not stones, but bile released from the gallbladder. I thought I had these successful flushes. I had no idea that these are not stones. Well, they are. You are getting material out your gallbladder, so don't be discouraged. I would suggest if you have not done it, you should do another ultrasound on your gallbladder just to see what it looks like. So typically, if a person, why would I do a gallbladder flush in the first place? Would be typically the person would have done gallstone, had symptoms of gallstones, went and did an ultrasound, and on the ultrasound of their gallbladder showed a lot of stone formation in the gallbladder. And then the recommendation from a medical standpoint is to remove the gallbladder, but that is typically not the best idea if you can tolerate trying to flush it out. So if a person does gallbladder flushes, you can get the gallbladder moving and get it flushed out. I've had people having really bad gallbladder pain, it's very serious gallbladder pain, have had ultrasounds done showing the gallbladder just being packed full of stones, and they just refused to get surgery, did gallbladder flushes, and it just was just very, very difficult. I had one woman who did not have cancer, but had other autoimmune issues, and I think she went through about 9 months of gallbladder flushes till finally she really released all the stones, and then she had a clean ultrasound on her gallbladder. So it can take a long time, but I would highly recommend that you get an ultrasound done to see exactly what's going on there. So you may not need to do a gallbladder flush. Most people don't need to do a gallbladder flush. So you should only really be doing it if you have gallstones. Is there any non-estrogenic supplement that quells mild to moderate hot flashes? And do you support supplementing with natural progesterone cream? So yeah, women who have estrogen ER or PR or HER2 positive cancers don't want to be taking progesterone. If you're PR positive, don't want to be taking estrogen. And typically you're getting those things through supplements. So you can take, so somebody who has also going through menopause is getting hot flashes, wants to take a supplement that will help with hot flashes. Typically, they're going to be an herbal that will stimulate some estrogen production. And then the counterintuitive thought is, well, why would I want to do that if I have ER positive cancer? Well, there's understand that number one, that just because you have ER positive cancer does not mean that all estrogens are bad. So it just means that the bad estrogens, that one group of estrogens that tends to block the estrogen receptor in the on the cancer cell is the issue. Now, typically, from a medical standpoint, they're going to give you an aromatase inhibitor or other estrogen blocking drugs that are going to knock out all your estrogens, sending you into menopause and causing you to have hot flashes. Well, then the thought is, well, why would I take something that would stimulate estrogen production? And there is some sense to that, but there's also, you have to understand that it's not all estrogens are bad. But so if you have ER positive cancer, PR negative cancer, you can take progesterone cream. Yes, you can. If you have ER PR positive cancer, then you probably should avoid progesterone cream. If you have ER positive, PR positive, or HER2 positive, and the first supplement that you should choose if you have hot flashes, in my mind, is something that will stimulate adrenal function. So using adaptogens should be your first go-to. So using some adaptogenic herbs that will stimulate adrenal function and help stimulate natural good estrogen production might be the first thing to do. Then if that still doesn't work, then you could try something like maca, try some of the other herbs, the black cohosh, and other herbs that will help stimulate some estrogen function and balance your hormones. You could also try if you're not postmenopausal yet, use an ovarian tissue supplement, a bovine ovarian tissue supplement. That can help too. So if you're not ER or PR positive, we have other people that are taking progesterone cream. Does my hammer bulb work just as effectively sitting next to me while I am sleeping rather than on top of me? Yes, it does. Yeah. And that's the only thing I was saying in other Zoom questions about the grounding sheet. If you're using a grounding sheet and it's up high on your bed and the bulb light falls down next to you, then you could be losing a lot of the frequencies right to the ground. If you're not using a grounding sheet, then having it next to you is just as fine as having it over the top of you. That's just fine. I know it does get warm sometimes. Wondering about specific hormonal support based on her monthly cycle. So somebody actually wrote this question for another person. She asked about doing a daily cheek swab and then sending them in all together for an AK testing. I suggested maybe doing a cheek swab once a week and sending it in for checking testing. So let me explain this question a little bit, what I think they're asking. So your hormones, especially a woman's hormones, will fluctuate in a circadian rhythm on a monthly basis. So your estrogen and progesterone are going to be different on day 1 than they're going to be day 5. So how do I know what supplements to be taking day 1, day 2, day 3, day 4 of my cycle? Especially if you're using some hormonal nutrition. This is a very difficult thing to ascertain for people because typically, let's say, even we're talking about like thyroid hormone. So if a person is diagnosed with hypothyroidism or Hashimoto's, it's typically based upon taking a blood test one time, and they have a high TSH, a low T4, and a low T3 at a given time. And then you're giving this person a medication to help stimulate, to supplement for this low thyroid. And it can make the person feel a lot better. But thyroid supplement, thyroid hormone also is secreted on a circadian rhythm. It's going to be different at 4 o'clock in the afternoon than it is at 9 o'clock in the morning. So taking a blood test of a hormone and then saying this is how much you need is like, I've always said, it's like taking a photograph of a moving train and then asking somebody how fast is the train moving. Well, there's no way to tell. You have a still picture. So that's the way it is with hormones. So doing a test for hormones is inaccurate at best. So there are some labs out there that will do a monthly cycle hormone test where you do a saliva test every single day and it's measured, and you basically are mapping out your period. You're mapping out your cycle. So they're measuring the progesterone, estrogen levels, testosterone levels, and your cortisol levels on a daily basis. And they're looking at, I think you actually take it every 3 days or something, or every 2 days. So you get like 15 little vials that you do a saliva sample with, and you do this for 15 days of your 30-day total cycle. And it gives you a really nice map. There's multiple labs that do that. It makes it much more accurate. But still, then, how do you know how many supplements to take if you're supplementing for that? That becomes very difficult. When I see a lot of thyroid patients, my suggestion for them was, we look at the blood work to see if we're in a fairly good range, but then how you're going to dose yourself is going to be based, it has to be based partly, if not mainly, on your symptoms. If you're feeling really sluggish today, your thyroid's probably pretty low, and you maybe need to add some more supplements, a little bit extra supplements for your thyroid. So you're feeling a little anxious and your heart is a little bit jumpy and racy, then you've got to back down on your thyroid supplements. You have to do it that way. I had hundreds of thyroid patients throughout the years, and that was the best way to do it. They had to play with their dosage. like that. This is the advantage of doing some of your own testing and sway testing and trying to get good at that and playing with your dosage like that. There isn't a perfect way to do that. This person developed a new rash since starting the new rife frequencies. Please advise. I don't think the new rash has anything to do with the rife frequencies because of a couple of reasons I'll tell you. You can get a rash from running a rife program because maybe you're detoxing and your liver is overloaded and you just be detoxing through your skin. So that is possible with these frequencies that I sent you. So that is possible. What could be done for rashes? Like to support the detox process? Well, that's a great question because they're totally thinking correctly here. Is there a detox rash protocol? Really, if you have a rash because you're detoxing, you need to support your liver. So really, you need to get going on coffee enemas, get going on castor oil packs over your liver. Make sure you're having, 1 to 3 bowel movements a day. Make sure you're getting rid of all your toxins. That's what you need to start. Go back to the 7 Phases of Detox book and just walk through that. You can do ion pro waves. You can try to support detoxing through your skin through doing saunas. So that would be a great thing to add is saunas to this and make sure you're doing your ion pro wave. Another person asking a question for someone else. The tumor site on her ankle has gotten really painful and large. Okay, this one this is an old question. We had this last time. All right, so people have sent in questions. I'm up. My updated Rife program came, thank you, and it is different. I used to have 16 night programs and no short day programs. Yep, so remember I said it's different. My new program has 1 set of night programs and 2 short day programs. So remember, on your day programs, it doesn't mean you have to do them. I gave you some day programs to do if you have time. So let's say, oh goodness, my day is so busy, I don't have time to do the day programs. Well, then don't do them, that's okay. But the day programs are there like, I'm gonna sit down and watch TV and I have my Rife here, what should I run? Then run the day program. So my bulb still gets hot, yeah, it will. I do not have a concern that the bulb getting hot. However, should I be concerned that everyone else is so different with this update? Yeah, because your program is different. But I did make everybody's program is 1 week. So I just wanted to get back to everybody getting more of their cancer frequencies in their program. This is a much more precise program. So yeah, you did receive the correct time. Thanks for the question. HBOT. Can that be done at any point in the chemo protocol? Or should it not be done? What they're asking is in the chemo protocol, should you not do hyperbaric oxygen in that 48-hour window? I don't see any problem in doing it in the 48-hour. I think you can do it anytime. I might be wrong, but I cannot think of any negative to doing HBOT, to continue doing it daily. Dr. Connors, is there one specific thing that we can be praying for you this week? Thank you. Well, that's very, very kind of you. Just for rest, that would be nice. And for me to get my voice back, that would be nice too. Thank you. If fenbendazole 222 milligram per day is taken for 3 days on, 4 days off, when and what test can be used to see if it is working or to adjust? So we would test with a cheek swab if this is what we recommended for you, and we would recommend the frequency of what we're doing. If this is something that you're just doing on your own, how do you know any cancer protocol is working? you go back to the tests that we've talked about. So that would be, whether it's a CT scan or MRI or a PET scan or a tumor marker test or whatever you're using to judge your care on whether we're going in the right direction or not. What do you think of using drip therapy, IV therapy, NAD? So with NAD, you have to be really, really careful because people can have really bad reactions to it. So NAD IV really came out to help with people that are addicts. So they're addicted to, typically it was used for drug addiction. And you can have really bad reactions to it. So I would be careful with it. When it first came out, it wasn't even legal in the US, and people were flying to Mexico to get it. And it was very helpful for people who were addicted to narcotics and different things. I knew a couple people, patients that actually went and did that. But I would say no to that. I would be very careful with that because you can have really bad reactions. You could even have bad reactions just taking NAD. So just be careful with that. Program I have for my wife is typically 9 hours and I often only sleep for 8 hours. Should I pause? Nope. Just get up, and you could either let it time out. I usually never turn it off. I just ended up letting it time out. And it will just shut off when it's done. Otherwise, if you're going to get up and you're not going to lay down again, just turn the machine off. That's the better thing to do, probably. What is the 1 hour, 38 minutes of short program frequency? Is it a general cancer program? I'd have to look and see what I did for you. I'd have to look back and see what I did for you. It's, I need to take beta 1,3-D. This is beta glucan, but I checked in your store and it is sold out. So we have several different brands of beta glucan. If you're looking at the one brand with the blue label, I don't know that we have that. I could actually look in the store really quick. We just came out with a brand new beta glucan that I'm really excited about. So you should look at that. Let me look at beta glucan. The one is the beta 1,3-D is from that brand is sold out. If this is something we tested you on, I need to recheck you to see if this new Betazyme from US Enzyme will work. It's supposed to be so much more potent. You need less capsules. I'm excited about that because it's always hard to be taking a bunch of stuff. And again, US Enzymes, above every other company we have even, is the cleanest, most anal retentive company in the world. I know the owner personally and know the reps very well that they're just really anal on the cleanse, the cleanness of the product. Purity of the product is what I'm thinking of. So I would suggest that if this is something that we tested you on. My hemoglobin numbers have been rising, but my platelets are dropping. Why would this happen? And are there foods that I can do to target my platelets? For your hemoglobin and your platelets, one of the things that can be good is beets. Another thing that can be good for this is spleen, which of course you don't eat spleen, but spleen extract tissue, and the only company that I know that has that is Biotics Research. That can be beneficial for that. Your platelets, if your platelets are really low, there is another product that we have from Valgensky that is the the Immunobel Pro from Belgensky, but it's really expensive. So if we could do it with other things, it would be better. That's the thing that's been shown to increase platelets, but it's really a pricey product. So we don't try not to push that if we can help it. What are your feelings regarding hydrogen water, specifically looking at the ECHO from Synergy Science? Yeah, hydrogen water has a lot of promise. It makes sense from a biochemical standpoint. It makes sense from a physiology standpoint. You can also use a hydrogen machine that are out there. I tested one of those at a seminar I was at a few years ago. It hooks up, it just sits on your desktop, hooks up to your body with a nasal cannula, and you sit there and breathe in hydrogen, and the absorption rate is very good across your alveolar space in your lungs. That can be very beneficial. It's something that I think I wrote a couple of blog posts about it a long time ago. It has a lot of promise. I don't know that, I've known a number of patients that have used it. I know a number of doctors that have used it. And like me, I was really super excited about it. We have an ECHO system, but I don't use it. And it's something that has a lot of promise, but I don't know that it's actually shown the promise that it has. So I don't want to say anything negative about it, but we don't even use ours. So can THC oil be taken at the same time as low dose LDN? So LDN is low dose naltrexone. Naltrexone is low dose naltrexone is typically used. It's a medication typically used for autoimmune issues because it can be an immune balancer, or what's called Treg cell stimulator. So it stimulates your T regulatory cells, which can help balance a hyperactive Th1 or hyperactive Th2 side. It's very good with autoimmune issues, and there's been some promise with its use for cancer. I do not know of any contraindication of taking THC oil or Rick Simpson oil, if that's what you're talking about. With LDN, I don't know. I don't know of any contraindication. We don't use LDN. That's a prescription product. When I used to see a lot of autoimmune patients, I used to recommend that they get LDN from a compounding pharmacy. We don't. It just never tested well for cancer patients, so I actually stopped carrying it. Are you familiar with the methyl blue product protocol used with red light therapy for cancer treatment? I am not. I don't know about that, so I'd have to look into that. I will. What would be a few good adaptogenic herbs to try for hot flashes? I would, let me step back here a second. So adaptogens, again, adaptogenic herbs are herbs that can balance your hormones. If they're too high, it can bring them down. If they're too low, it can bring them up. So that's why they're called adaptogenic. It helps you adapt to your environment. It helps balance your body and your hormones. I think we carry about 6 adaptogens. One of my favorite is the product NuAdapt from Orthomolecular. The reason why I like that is it has some things in it that can help calm your brain as well, which again, that's what controls everything, right? Is your brain. So NuAdapt is a great herb to start with. Probably the most, our highest sales of adaptogenic herbs is Premier Research Labs Adaptogen R3. That's a very clean product, a very good product. TruAdapt is another adaptogenic product by Orthomolecular, And that might be even better for hot flashes. So there are just some little bit different combinations of those. But if you're having hot flashes, I think I'd probably go with the TruAdapt, TruAdapt by Orthomolecular, and I would try it for a couple of weeks. I'd try it for a bottle, and I'd start with taking one a day, and then after a couple of days to go to two a day, up to three a day. The nice thing about adaptogenic herbs, you really can't OD on them. So especially if you just kind of titrate up and down. What liver supplements are helpful to take? Well, go back to my book, The 7 Phases of Detox, and the detox, out of the 7 phases, phase 1, 2, and 3 are really talking about the liver. And they give you some options of supplements to help support phase 1, phase 2, phase 3. There's other things that just help liver cells themselves, like CoQ10 and some bovine liver support that aren't specific to the detox pathways. But if you're talking about helping with the liver detoxification pathways, look at that book and I list some different supplements. What is the difference between the hammer bulb and the double bubble? I have the older Rife. I use the hammer bulb at night and the double bubble during the day. I cover the hammer bulb at night. I assume covering's okay, as the light bothers him. So this person's using it for her son. The double bubble is going to be stronger if you have it right up next to your body. So the beauty of the hammer bulb is that it's easy to put next to your body because you can snuggle with it and cuddle with it. Now, we recommend and we sell the crystallized hammer bulb with all our patients. So I don't know if you have the crystallized hammer bulb or just the regular hammer bulb. And if you don't have the crystallized, I'd say just stay with what you got. The double bubble, theoretically, and it is stronger if it's really close to you. The negative is that you could get some little shocks if it's touching you, but it's nothing that's going to hurt you. It's good for you. So when we used to have people come into the clinic, we used the double bubble because it's just the way we had it set up in the stand. It does become cumbersome. You can break those things. You have the little microphone stand for it. It can become clumsy. So there's some negatives to the double bubble, but it is stronger of a bulb, especially if you're going to be, have it be away from you during the day and you're kind of walking around and you come up next to it, it's going to go farther distance. So that would be the advantage. But if you're just going to be sitting there and you're not moving and you're just using the double bubble on you, you might as well just have the hammer bulb. You only need enough strength for it to penetrate your body. Anything else is just wasted. So the whole claim to fame about strength with like the GB4000, oh, it's stronger than the TruRife. I do agree, it is stronger than the TruRife, but how much strength do you need? You just need enough strength to get through your body. So the GB4000, you can measure out 20 feet. The Rife, you can only measure out, 8 to 10 feet. If you're thinking you're going to be rifing during the day and be 20 feet away from the GB4000 and think you're going to actually get healthful benefits from those frequencies, you're fooling yourself. So you just need the strength for it to penetrate the body. What do you think of hyperbaric chambers to fight the cancer? So we talked about that. And another question, hyperbaric is a great therapy. Most of the research on hyperbaric and cancer have to do with brain cancer, but hyperbaric forces oxygen into your tissues. Anytime you can do that is a benefit. Hyperbaric is fantastic for any cognitive issues, cognitive loss, early dementia issues, to help ward off early dementia, Parkinson's, Alzheimer's type things. Hyperbaric is great. And just for a healthy thing for cancer. The only problem I have with hyperbaric is that literally all the studies are doing it daily. And that can become just a problem, you know, um, to be able to get to some place that has a hyperbaric chamber. If you can afford to buy your own hyperbaric chamber in your house and you could do it daily or even 3 times a week, you will probably notice the difference just in your clarity of thought. There could be a lot of benefits to it. What has been your experience with DCA? DCA is a product that typically you're taking with MCG GAF and GCMAF, and it was typically used together, but now people are using it separately. We've had patients use GCMAF and DCA over the years. Our experience has been very mixed. Like we talked about with that other question that I said I'm going to make a video about, when GCMAF first came out, we saw much better results. The newer form of GCMAF, we just haven't seen really any good results with patients, but that doesn't mean they don't exist. I'm just saying my experience with that. When would you recommend IV infusion of high-dose vitamin C? That's when we do the testing. If that comes up positive, we do make that recommendation. And we do have a number of people that are doing that. So if that doesn't come up positive in our testing, then I don't recommend it. But some people are still doing it, and that's fine too. So that's a choice everybody has to make. There's some negatives to these things too. We had a patient in the hospital for 2 weeks because they were doing IV vitamin C, and it caused a lot of swelling, and she's convinced it was from the IV vitamin C. That's not something we tested positive for, but it's something they chose to do. And so there's some negatives. You got to be careful with doing that too. What about the home version of the hyperbaric chamber, I think? Yeah, the home units are fantastic. They're great units. They're expensive. But you could get a great hyperbaric chamber to use at home and do it every day. Typically, you do it for an hour, and it's you get used to getting in there, sealing it up, turning it on. It's pretty easy to do yourself. You don't even need anybody at home to help you, as long as you can get in and out of it. I can't do them because of my sinus issues, but if some people can't do it because of claustrophobia too. I suggest you try it before you go buy one. Try a unit somewhere. I know that OxyHealth has home units that they rent to sell, so they rent to own. Those I think are the best units. There's other companies out there that have good units. They're a little bit thinner material. OxyHealth, I think, will last you longer. You're going to have less problems. They're a little more quality. But can a cheek swab test for IV vitamin C for a patient? Yes, we do test for that. So if you didn't have that on your recommendation, it didn't test positive for you, right? Right. Thank you, guys. We will bid adieu for the evening. Have you much experience with Cellcore products? We do. We use Cellcore products a lot, and they can be great chelators, great binders. That's really what they're known for as a company. Um, they have some good stuff for sure. All right, remember to ask your questions through the patient portal, your membership site, if you can. Notice that a lot of you are doing that. Most of you are doing that now. And we'll have this video, God willing, up on the site as well. Thanks to everybody for attending. And Another quick question about Quicksilver. Quicksilver products are great products too. Very good products. Very good company. All right. Bye-bye now.